What could anyone have imagined, on January 1st, at the dawn of a new decade, what 2020 would hide? It changed the world like never since World War II. Within 12 months, the new coronavirus has paralyzed the economy, invaded societies, and quarantined about 4 billion people in their homes. The epidemic claimed the lives of more than 1.7 million people. About 80 million people were infected with the emerging coronavirus, which is likely less than the actual number. Children lost their parents and grandparents, while some died alone in the hospital, with visits being prevented due to the risk of transmission. Many families celebrated birthdays in the absence of loved ones with the disease, or in small groups, under increasingly strict health and travel guidelines, especially after the discovery of a new, more contagious, epidemic strain in the United Kingdom. This pandemic experience is unique in the life of every person on Earth, says Steen Vermund, an epidemiologist specializing in infectious diseases and dean of the School of Public Health at Yale University. In one way or another, each of us was affected by it. However, COVID-19 is not the most deadly pandemic. The plague took the lives of a quarter of the world's population in the 14th century. At least 50 million people died of Spanish flu between 1918 and 1919, and 33 million died of AIDS in 40 years. However, to be infected with the emerging coronavirus, it is sufficient for a person to breathe in the wrong place and time. Chinese Wan Shunyue, 44 years, summarizes his experience with the disease, which was hospitalized for 17 days. I reached the gates of hell and came back. I saw those who did not recover and died, and that left a deep impression on me. No one could have imagined the scale of the disaster when the Chinese authorities announced, on December 31, 2019, that 27 cases of viral pneumonia had been recorded in Wuhan, central China. The next day, the authorities closed the live animal market in Wuhan, on suspicion of being linked to the emergence of the virus. On January 7, Chinese officials announced the identification of a new virus called 2019 nCoV. On the 11th of the same month, China reported its first death in Wuhan. Within a few days, injuries began to be recorded in Asia, France, and the United States. At the end of January, countries began to evacuate their citizens from China, and the borders began to close, while the more than 50 million residents of Wuhan, Hubei province, were placed in quarantine. Pictures taken by the French press agency of a dead man on a sidewalk in Wuhan with a muzzle on his mouth and a plastic bag in his hand attest to the horror that surrounded the city, even though no official has never confirmed the exact cause of his death. When the Diamond Princess cruise ship docked in Japan in early February, it was found that more than 700 of its passengers were infected with the virus, and 13 of them died. Terror spread across the world, and the race to develop a vaccine began. And put the small German company BioNTech aside its research on cancer, to focus on a new project called Lightning Speed. On February 11, the World Health Organization declared the epidemic name COVID-19. 4 days later, France announced the first death outside Asia. Europe was horrified as northern Italy became a hotbed of disease in the ancient continent. In March, Orlando Galdi, the mayor of Vertova in the Lombardy region where 36 people have died within 25 days, spoke of his despair by saying, "It is absurd to see in 2020 a similar pandemic worse than war," and imposed Italy, Spain, France, and Britain a complete closure. The World Health Organization declared COVID-19 a pandemic. The United States closed its basically closed borders with China, to most European countries. For the first time in peacetime, the Olympic Games were postponed. In mid-April it was 3.9 billion people, that is, half of humanity, they live under some form of lockdown. From Paris to New York, passing through New Delhi, Lagos, London, and Buenos Aires, the silence of the desolate streets was not penetrated, except for the ambulance sirens, a reminder that death was in store. For decades, scientists have been warning of the possibility of a global pandemic, but their fears fell on deaf ears. With this epidemic, the richest countries are powerless in front of this hidden enemy. In a globalized economy, disrupted supply networks have sent panicked consumers into the supermarket. The results of the chronic lack of investment in health facilities were evident, with hospitals struggling for the continued functioning of intensive care departments in which the number of patients exceeded their capacity to absorb. And crews, already struggling with low wages, were fighting the battle without the necessary precautions. Nilima Veda Bammer said, "Doctor in Bombay, I got my degree in 1994, and official hospitals have been neglected ever since. Why did people need a pandemic to wake up?" he asked. India is the third country most affected by the pandemic, after the United States and Brazil. In New York, which has the largest number of billionaires in the world, pictures were taken of medical personnel wearing garbage bags to prevent the virus. A field hospital has been set up in the center of Central Park, and mass graves have been set up on Hart Island, off the Bronx neighborhood of the city. "It's like a horror movie," said Virgilio Neto, the mayor of Manaus, Brazil. "We can no longer talk about an emergency. It is an absolute disaster, the bodies piled up in refrigerated trucks waiting for bulldozers to dig huge mass graves. Companies are closing down, and so have schools and universities. Sports meetings have been cancelled. Civilian air traffic is now almost halted. Witness the worst crisis in its history. And closed shops, bars, clubs, and restaurants. In Spain, very strict lockdown measures were imposed, during which even children were prevented from leaving. People found themselves stuck in very small apartments sometimes for weeks at a time. And start working from home for people who can. Video conferencing has replaced business meetings, travel, and celebrations, while people whose jobs require their presence in person have put their lives or position at risk. In May, the pandemic caused 20 million people to lose their jobs in the United States. In 2021, the World Bank predicts that 150 million people will be plunged into extreme poverty due to the economic recession. The social inequality recorded for years has worsened. Hugs, handshakes and kisses became just a memory, while the exchange of conversations took place through masks and plexiglass condoms. The level of domestic violence and psychological problems increased. As well-off urban dwellers sought refuge in other homes they owned in the countryside or on the coast, governments floundered in the face of the scale of the crisis, while the anger simmered among those stuck in the cities. The United States, which has the largest global economy without providing health coverage for everyone, quickly became the country most affected by the pandemic with more than 300,000 deaths. But President Donald Trump regularly eased the threat of the disease, promoting unproven treatments such as hydroxychloroquine. It is also suggested to treat the infection with Jafile water. In May, the U.S. government launched Operation Warp Speed, which has committed $11 billion to develop a vaccine by this year. Trump considered it the largest American effort since the development of the atomic bomb during World War II. But neither the rich nor the influential can buy immunity against the virus, so Trump contracted the virus last October, and his Brazilian counterpart, Jair Bolsonaro, accepted it last July. British Prime Minister Boris Johnson spent 3 days in intensive care in April. The virus infected actor Tom Hanks and his wife Rita Wilson, as well as Portuguese soccer star Cristiano Ronaldo, tennis champion Novak Djokovic, singer Madonna, Prince Charles, the Crown Prince of Britain, and Prince Albert II of Monaco. With the end of the year approaching, the first vaccines began to appear on the market, even though they came too late to save Trump from his electoral defeat against Democrat Joe Biden last November. And the giant U.S. laboratories, Pfizer, and its partner, BioNTech, announced the development of a vaccine that is 90% effective. And governments scrambled to secure stocks of these vaccines. A week later, the American company, Moderna, declared a vaccine that was 95% effective. Governments are preparing to vaccinate millions of people, starting with the elderly, medical personnel and vulnerable groups, before expanding the vaccination scope to include the entire population, which is the only way to return to normal life. In this December, Britain became the first Western country to license the Pfizer-BioNTech vaccine, and before that, Russia and China began vaccination campaigns with their respective vaccines. Then the United States began vaccination, while Europe gave the green light to the Pfizer-BioNTech vaccine. As the wealthiest countries scramble to buy vaccines, it is expected that the beginning of 2021 will witness international competition for vaccines. China and Russia will strive to promote their better-priced vaccine, especially in Africa and Latin America. It is difficult at present to estimate the lasting impact the pandemic will have on societies. Some experts believe that achieving herd immunity takes years, while others are betting on the return to normalcy in mid-2021. Some argue that the pandemic could lead to a more flexible approach to telecommuting or even partial transfer of production chains. On the other hand, others argue that fear of large gatherings will have profound consequences for transportation, tourism, sporting and cultural events. The impact of this on civil liberties is another concern as well. According to analysts at Freedom House, that democracy and human rights have regressed in 80 countries in the context of the response to the virus. Steen Vermund of Yale University predicts profound changes in societies. And if remote work becomes the norm in the service sector, what will happen to the downtown real estate market? Will the population decline in urban centers as many move into spacious spaces as they seek to avoid overcrowded transportation? It is expected that the global economy will experience new shakes. The International Monetary Fund has expressed concern about a worse recession than the one that followed the 2008 financial crisis. However, many consider the pandemic to carry a more devastating and sustainable disaster. COVID-19 is like a tidal wave that struck us, but behind it is a tsunami of climate change and warming, warns Lewis Dartnell, an expert in astrobiology and author of the Encyclopedia of Disasters and Resilience. What could anyone have imagined, on January 1st, at the dawn of a new decade, what 2020 would hide? It changed the world like never since World War II. Within 12 months, the new coronavirus has paralyzed the economy, invaded societies, and quarantined